I started doing peer support, and that would have been 1989, 1990. And then I went up to California and I met a person named Howie the Harp. And that would have been 1991.
Okay.
1991. So Howie the Harp, I brought back Howie the Harp to New Mexico. That's when I was living in New Mexico. And Howie the Harp taught me. First, I went to Berkeley. I went to Oakland, where Howie was, and I saw how Howie did peer support. But Howie was like I was. The mental health system didn't want peer support, right? So Howie set up the Oakland Drop-In Center. That was just completely like if anybody was homeless, they'd come see Howie, and Howie would take care of them. And Howie had learned from Ed Roberts, who I had known when I lived in Berkeley. Ed Roberts was the guy who started the whole disability rights movement in Berkeley, right? And he started after that the independent living centers. And independent living centers for people with disabilities went all over the United States. So Howie had been working with Ed Roberts out in California, and I knew Ed from when I had lived in California. I actually knew Howie when we first came to California. He was almost mute and just stood on the corners and stared at people. But he was very together at that time when I met him. And he was like doing this peer support at the Oakland Drop-In Center. Then he came out to be with me in New Mexico, and that would have been 1990, 91 when Howie came to New Mexico, because it was about 2 years before I came to Boston. So Howie came out, and that picture, off and on you see pictures of Howie the Harp. That's a picture I took of Howie against the Sandia Mountains when he came out to Seaway. And the Howie the Harp Center in New York City, which teaches all peer support specialists for New York City, is named after Howie the Harp. So Howie came out, and he was with me, and then he kind of like, and I still have him on tape. I saved Howie spending the training that Howie gave us. I saved that on tape. Howie meant a lot to me. And so then I started doing peer support. Then I got hired by the University of New Mexico to work with the initial rollout of case management in New Mexico and be the peer. It wasn't called peer, it was called self-help then, self-help groups. It wasn't, or consumer as employees. We were consumer as employees in those days. And so then Howie the Harp went back to California, and I started working with the University of New Mexico, setting up these self-help groups for people in the Albuquerque area. And what I did was I made pamphlets. Hi, I'm Mo Armstrong. I laid it out there. Hi, I'm Mo Armstrong. I'm mentally ill. I'm looking for other people who have mental illness. Would you like to meet with me on a meeting at a laundromat? So we met at this laundromat in downtown Albuquerque. I did that, and I worked for a clubhouse in Albuquerque at that time. And so at that clubhouse in Albuquerque, it was called ROC, Recreational Health and Occupational Center. Don Naranjo was the director. I worked for that. And what I did then was educational support groups, but they were based on Lieberman, this Lieberman model. Lieberman had all these structures, like what you would do to get people from A to Z that he had figured out as a psychiatrist. Bob Lieberman, as a matter of fact, I saw him spoke at Yale here, and I think he's died now, Bob Lieberman was, but he set up all these modules because he thought that people with psychiatric conditions could learn. He thought people with psychiatric conditions could learn what a condition is and how to navigate through life by understanding our symptoms and our condition. And so anyway, I did that. And then I was at a conference in Oakland, California. And I'd been reading all this stuff from Boston University. I just couldn't believe it, because in my time, 1966, when I first got discharged from the hospital, having a psychiatric condition was just like, I was seen as the scum of the earth, my parents had abandoned me. Like nobody I grew up with had anything to do with me. Everything was like totally like wiped out. And so, in my life. And so anyway, next thing you know, I'm reading all this stuff about, psychiatric rehab at Boston University, and those of us have psychiatric conditions, we've got honor, we got pride. And I'd already been learning from people who had physical disabilities that they had taken that up. They were once called crippled, and now they were like, trying to go back in the workforce, and they had reasonable accommodations, and they were working on a law which later became the Americans with Disabilities Act. And I thought that was very important, for those of us that had psychiatric conditions, even though I was also a peer worker with the Independent Living Center in Albuquerque. So if somebody had a psychiatric condition in Albuquerque, I would also deliver peer support. So I was doing peer support in the community on my own, like with the National Alliance of Mental Illness, or on mental illness. I was working with the Independent Living Center doing peer support. I had a full-time job. So I was doing all those things in Albuquerque to do peer support. Then I went to this conference that, Boston University was a big part of. It was a conference on psychiatric rehabilitation, and it was in Oakland, California. And of course, because I'd been on the streets, and I knew California, knew Oakland, the East Bay, knew Berkeley, I was comfortable. So I was like in the bushes, like telling these guys about the great news, like, hey man, we don't have to live like this, their services. See, the minute I understood that I, as a person with a psychiatric disability, this wasn't a sentence, this was an opportunity. In other words, I could have rehabilitation services, right? I went back to school, I got my degrees, I was getting an education, I was working, doing things in mental health, I was getting a salary. Yeah. And the minute I understood it was an opportunity and not a sentence. In other words, before I thought, wow, man, I've been like diagnosed, or I have the psychiatric condition, and it was seen like a, what do you call it? It would be like a sentence, right? Yeah. Now I see that that's not the case, and I did then too. And so, anyway, I was telling these guys in those bushes, and this guy, many of the articles I read were by Leroy Spaniel and Tony Zippel. I see, and they wrote all these books on all these different techniques to do psychiatric rehabilitation and bring people back to what I call sane, stable, safe, and sober levels, right? Mm-hmm. And so I walked out of the bushes, and there was Tony Zippel himself. It was like Elvis, right? He goes, Tony Zippel, my God, and I just latched onto him. I said, you won't believe it. He couldn't believe this guy was in the bushes with those homeless folks, and all of a sudden I'm talking to him on the street, and I'm at the conference with all the rest of them, right? I'd gone from like being in the bushes with all these people who were homeless until I was like a participant in the conference. So then he took me in, and he said, look, if you ever want to come to Boston, you call me up and I'll find a place for you and a job for you to do. So, I was out in New Mexico because in New Mexico, 70% of the budget went to the state hospital. See, so there's never going to be community services. I was never going to learn about like what residential living is, or I was never going to learn any of that. It was all going to be just 70% of the money goes to the state hospital in Las Vegas, New Mexico, which is where Frank went to school. And so I said, okay, I'm taking it up because I want to learn about all the services that are available. And the only way I can learn this, first off, before I started working, actually, I have been an advisor to the Department of Mental Health in New Mexico, and I resigned. I said, I don't want to do this. I said, I need to work with people in the mental health field to understand what's going on, because I don't really know. I'm here making policy, but I've never done this myself. And so I need to leave you guys. I just need to go work in mental health and see how that operates and what that does. And so I did that, and that's how I ended up working for the clubhouse in Albuquerque. Then I went to Boston, and Tony moved me right up. I was under him. I was like next to the vice president in the organizational chart. I had a very high place with Tony, and I very appreciate that. And I said, I'll come to Boston. The only thing I want is 24-hour access to all people and all programs in Vinfen Corporation. So Tony gave me that. So I had access to all people and all programs in Vinfen, and that was all I wanted. So I just started doing this educational, setting up support meetings. I had a whole newsletter. I made up a whole newsletter and did all. So that would have been 1993. Okay? And then around 1998, it became formalized. And that's when I started. There was another person named Ed Knight, and I had worked with Ed. When I was in New Mexico, he was in Colorado, and then I came out to Boston in 93, and Howie the Harp came back to New York to set up peer support in New York City at that time in 94. And then Howie and I talked about how we'd merge Boston and New York together, although Howie died just maybe a year after he got to New York. And so Ed Knight, and it was called Self-Help Groups. And so Ed Knight and I started doing the self-help groups. So around 1998 was when Naomi Pinson, who was working with us, and I was married to at the time, said, no, we're not doing that. We're doing peer work. So I said, oh, that's a good idea. She said it's more mutual. Self-help groups are kind of like, we're not helping ourselves, and we're not doing this by ourselves. We're doing this together, and peers assign that we're doing this together. So I said, you're right. I said, well, I'm going to change the name, Peer Specialist Project. Peer Educators Project, because I want people to understand like what we do, how we do it, and so they can get a better grip on it if I call it peer, because self-help means that we're just doing it by ourselves. So we started the Peer Educators Project. And I still have some brochures here from that, I think somewhere around here. I don't know where. Let me see. Okay, I'll find them later.
Yeah, we can find them later.
So I can find them later.
Yeah.
So anyway, I started doing that, and then that would have been 19, and that's when I did a Ted Koppel show. So I did the Ted Koppel show, what is that, 1999, I think. That was when I did Ted Koppel. ABC Nightline came in, they followed me all over town. I was setting up these support meetings all around Boston and all through the Commonwealth of Massachusetts. And then Ted Koppel came and interviewed me, and then they came around and saw all the different support groups I was doing. And then I think it was 2001, maybe 2001. That time, Ike Powell and Howie Vogel came up from Georgia. See, my thing was I wanted peers to have our own way of doing things, our own toolkit. See, like rap is a little toolkit, right? Yeah. So you come in, you do a rap program. You know, in those days, no, peers didn't do rap. See, peers didn't do rap. Rap was something professionals did for people, you know, even though Mary Ellen Copeland discouraged that wasn't the way it rolled out. Gotcha. So I wanted us to have these kind of specialty gifts that we could give to the mental health system, because they kept meeting, everybody I met kept meeting, they wanted to give back to the mental health system. But many of them didn't want to work full time. They only wanted to give 4 hours, 6 hours, 10 hours, keep their benefits, keep their things, and give that amount of time and work to the system that it helped them. So the Peer Educators Project fit into that perfectly, right? Because I was hiring all these part-time people. And during that time, about 30% of my employees were veterans. So I was able to get people from the VA, veterans that were doing well, even when I was homeless back in 66. 67. Now that's a joke in my recon unit. I was probably the first Vietnam veteran who was homeless. But later on, as I met other people who were homeless, most of the people who could take care of themselves and were doing good were veterans, right? They weren't like just trashed out, down out. Most of the veterans were homeless, but they were like, it was like being on patrol or doing a bivouac or something, right? And they were able to live outdoors and be comfortable and not like just totally be self-destroyed with frostbite and all kinds of weird things that can happen to people by living in the elements. So it was the same with this mental health. I was finding veterans who wanted to make a contribution back to society and back to other people, and I hired them to work in the public mental health sector, because those of us that get veterans care for mental health, we're recipients of public services. Mm-hmm. There's a big difference. I think there's a big difference between people who receive public health care and people who receive private care. Mm-hmm. You know, I have a friend who runs a clinic. I know he's another peer. He runs a clinic in Laurel Canyon, or you know, Anthony Hopkins, the actor, is part of, goes to his clinic, and I mean, their life is just indescribably different than our life. You know what I mean? I mean, those guys live like you could. It's a dream come true. You know what I mean? It's like beyond the Holiday Inn hotel, or I mean, you can't even compare it to anything like that. You know, woodland walks where you get your life together. We don't have that. You know, those of us in the public sector, we just have kind of what we're given and who we're given, and we try to make the best of that. Okay, so I wanted people, the veterans I hired, then they felt comfortable in the public mental health world because they were also part of a public veterans health world. And that worked out very well. So about 30% of the workforce I had with the Peer Educators Project were veterans doing peer support in Massachusetts. And so then we did that. We did that for years. We did that from 93 to, what was that? Like 93 to 2000, through 10 years, 2006. I kind of was doing it both because about 2003, I got offered a chance to come to Connecticut. This is how dumb I was. I got offered a chance to come to Connecticut, and research was peer support effective, right? Which I thought was important because everybody kept telling me, well, this peer support you're talking about, it seems effective, but where's your data? You know, everybody's, where's your data? Where's your data? So I said, okay, I'm going to take these guys up, Bob Rosenhack and the VA here. I'm going to do a research study on the effectiveness of peer support. So I did that, and I was driving back and forth between Boston 2 or 3 times a week, man, just to set this thing up here. So I was still doing the peer support. See, so I drive out to Springfield, Massachusetts, and then from Springfield, I'd drive down here, for instance, or I'd sometimes come directly out of Boston here, you know, and I have to drive back, sometimes the same day. And it was just like, it was brutal. But I wanted to set it up. I wanted to do the research. I wanted to make sure that what we did was credible with, you know, because it was all, we were being researched by PhD folks, and they were Yale researchers mixed with the VA. So then I did that, and then 2006 I left Boston and then came to work here full time with the research project. And then after that, I was trying to set up peer support without doing a test. See, so what I wanted to do was do the vet to vet, and then people would learn how to take these modules. See, these modules I felt could be, I mean, these modules could, like, well, look, like the center, like you have psychologists who do CBT, or you have other people do different modules that they bring in, right? I wanted us peers to have modules that would be totally peer-oriented modules that we would bring in, and we would offer these educational gifts to people, okay? But then the VA got a person in the central office, I've forgotten her name now, Chris got miffed. Chris got miffed that I was rolling out peer support in the VA before she did, because she wanted to get credit for rolling out peer support. So I was doing vet to vet before Chris. So what Chris did was she set up the peers as workers in the VA. And that was going to see. So what they did when they went to Georgia, not Larry Fricks. Larry Fricks ran it, but it was Ike Powell and Holly Vogel. They got billable hours for doing peer support. But I had already worked. See, I'd already worked for a Medicaid paying authority in New Mexico. So I knew what went into getting Medicaid billable hours. It's a lot of paperwork. And I went through a Medicaid audit in New Mexico. You know, the whole agency went through a Medicaid audit in New Mexico, and that's just brutal. Nurses just tear the notes apart. They try to find anything wrong, anything I might say that would be in contradiction to the treater above me, or I would get in trouble, and the agency would have to refund that money. Now, what I did was I set up the notes in Describe, Assess, and Plan. So my Describe was what I said, the Assess is what the person said, and Plan was what we were doing together. So it was all direct quotes, right? It had nothing to do with I was assessing that person's mental status, right? It was all what I said, what they said, and what we were going to do together. So my notes didn't get bounced, but it's still a lot of paperwork. So when I set up the peer support, when I set up the Peer Educators Project, what I did was I wanted it to be, so we didn't have to do that. We didn't have to do that. And if I could get people hired, which at Vinfin I did. So at Vinfin what I did was they just hired people, and they still do. They hire people just to be peers. Like they would, instead of a direct care worker, all you need is a driver's license and a background check and a high school education. You know, and I knew people at that time. In Boston, I'd known people at that time that didn't have a college education, and they had actually worked their way up into management positions.
Yeah.
You know, with just a high school education and driver's license and background check. So that's what I thought would be good enough for the peers. I didn't want to do this peer specialist thing. Plus, I thought the peer specialist thing would kind of isolate us and have a glass ceiling. In other words, peers would always be peers, right?
Yeah.
Couldn't do anything else but be a peer. And I still think that holds true today. And so then, after that, well, what we did was Chris and the VA Central Office, they set me up. So the first peer specialist test, VA, I was in that class, Bedford, Massachusetts, and they failed me. They failed me on the test. They wouldn't let me see the test, and they wouldn't let me take the test again. So all of a sudden I'm going, and then they used it against me. Then they used it, well, he can't really be a peer because he didn't pass the test. That's how insane this. Even though I've been a peer before they were born. You know, I was homeless in San Francisco in 1966, stabbed in the tenderloin. I mean, you know, I felt like Paul or something. You know, on the, you know, going out and getting beaten in the roads by irate people. You know, Paul from the Bible. Yeah. So I felt like, I mean, what do you want me to show you for my credibility, my credentials? So anyway, so there I was stuck, right? And I couldn't do much. So I was kind of frozen because the word was out that, you know, but I kept doing the vet to vet with the researchers and kept doing that. Then the state of Michigan found out about that I had been worked over by VA Central Office, and they had me come out to Michigan and do the peer specialist training in Michigan. And at that time I took my wife, who spoke almost no English, right? I took the entire course that they were teaching me. I translated that course into Spanish. I taught my wife the entire course that I was going through. And when we came back, not only did I pass the test, but my wife passed the test. Now, she had to read the question in English, but they let her answer in Spanish and then translate it, right? And because of my instruction, because I understood that material so well, which made me suspicious that maybe I passed the test previously, you know what I mean? That, you know, because if I passed it that well, where I'm able to translate the entire course into Spanish, teach it to my wife, and have her pass the test and I pass the test, it made me believe that maybe I had passed the test previously. You know, we all have doubts, you know, like, well, maybe I didn't do that right, or maybe I did this wrong, or maybe I did that. But then the second time when I passed the test and my wife passed the test, I thought, well, you know, I got set up. That's what I think today. I think I got set up. But it didn't matter because I passed the test. And I went back and then I applied to be a peer because the research project was ending. And here I was in Connecticut, and I had just bought this condo, you know, because I was living in a transitional living space for about a year. The VA gave me a place to live, so I didn't have to drive back to Boston and wear myself out. You know, after a couple of years of doing that, they let me stay at a transitional housing space. So then I bought this condo, and I had this condo. So I said, well, I might as well stay here. I'll leave Boston in 2006. I'll stay in Connecticut, and I'll work in Connecticut. And so then I started working with Mary Speraza and Lori Harkness at that time. Lori was the director, and Mary. And so my luck was that Mary, having an occupational therapy background, understood the importance of education. And so she let me do all these groups, which is what I wanted to do. I just groups. No, I call them meetings. Better call them meetings, because groups is kind of what the professionals do. What we do as peers, I prefer to call meetings. And so then Mary let me do all these meetings and all this educational stuff. And Mary would even be finding educational stuff that we could look up and maybe teach in some of those meetings. And then that worked out very well. And then I've forgotten when I retired. I've forgotten now, maybe 10 years ago or something. And then, but I just kept doing vet to vet, because no matter what I did, well, you know, people wanted to know about vet to vet. Like less than a year ago, I had got a call. I had rolled out vet to vet in Wyoming. You know, I'm got a call for Vet to Vet. I rolled out Vet to Vet in New York State. I just kept rolling out Vet to Vet, even though I was no longer working. I was retired, but I had the retirement money, and I figured it was better to be of service and be of help to people. And at least they'd learn how to do what I would call peer support work educationally, which is, for me, what's really important. That's what can set us apart. That's why I'm motto of Vet to Vet and the Peer Educators Project was each one, reach one, teach one. Each one, reach one, teach one. And it was based on what I had learned as a kid. As a kid, Mom would go down and donate summers at a school in Mississippi, Piney Woods, Mississippi, run by Lawrence Jones. And he was taking people out of sharecropping just with a blackboard and some benches. So just with education, I could see how important education was and how it could really lift people up out of wherever they were at, and they could have a better life if they had knowledge. And I felt the same was true for those of us that had psychiatric conditions or mental health conditions, that we could lift ourselves up. And I had learned that also because I spent a day at Gallaudet University in Washington, D.C. See, and people who are deaf, right, they were kind of marginalized also, right? And then they put together their own universities, they put together their own study centers, and they were able to, through education and teaching and learning, they were able to actually lift themselves out of just being. See, when I grew up, if you were disabled, it was the reason it's called handicap is because people had a cap in their hand baking on the streets. So when I grew up, people with disabilities, let's say back 59, 58, well, that would have been Galesburg, so that would have been 56. People with disabilities just sold pencils on the streets. That was all they did. They just sold. There wasn't Social Security or anything. They just sold pencils on the street, trying to make a living. So that's why the term handicap, because it means the cap is in the hand, right? And they're just kind of begging for money on the street. And that's where that term, that's why it's not a very good term to use. People with disabilities is a better term, not handicapped. And so it comes from that very, very sad, very, very prejudiced, really, point of view that people with disabilities are only good enough just to beg in the streets for stuff. So then I realized that was also going to work for those of us that had psychiatric conditions, right? That we could be the Gallaudet University. We could have our own lives. We could have our own centers. We could have our own education. We could have our own groups. We could become a subgroup of something. You know what I mean? Within the disability world, right? Even, because that's good enough for me. I mean, I don't know how many several million people have disabilities. I mean, that's more than I've ever dreamed of. And I don't know what 7 million people, I think, or more than that now have some kind of psychiatric condition. I mean, that's more people than I need to do anything with. It's several million people. So that's how I started, and that's kind of how it came to an end. And then, the cancers hit, and next thing you know, I was just another patient in the oncology world and getting cancer treatments and almost died. And then I realized that cancer patients had no support. And so next thing you know, right now I got to get myself free from these cancers if I can, which, one seems to be, the prostate seems to be starting up all over again. But if I can do that would be what I'd like to do. And also cancer patients, every cancer patient I met has some form of clinical anxiety, post-traumatic stress from all the treatments. You can imagine being in these rooms with needles hanging out of our arms, all day long doing infusions. I passed out and almost died in the infusion room, as a matter of fact. I think I almost went to heaven, So, I mean, it was, cancer's pretty brutal. And so, so most of the other people have some kind of post-traumatic stress. They have high levels of anxiety. They're depressed. They're never going to be the same. They're going to be like me, stumbling around the house, not being able to go places they needed to go. And so I'd like to do that next is, I'd like to continue with the mental health. I always feel like, I'm a mental health person. I'm a person with a mental health condition. But also now I see that the cancer, I thought we in mental health were behind, but now I'm realizing that we're actually ahead. That oncology and the physical, I mean, people with diabetes should have peer support. They're just, they're just monitoring their diabetes all along. They aren't like coaching each other, like how to live differently, how to eat differently, right? I mean, all these other medical lines need peer support,
Right.
and they don't provide it. It's not just oncology, just diabetes, post surgery op. I mean, I had an appendicitis, and I was opened up just 2 or 3 years ago in the hospital, and then there was no follow up. The guy just said, "Hey, you're doing fine, right?" And yeah, it's like mental health used to be that way, right? You said, "Okay, you're doing fine, but now you're okay because you're no longer in the hospital." And so what we did in mental health was we set up 5 evidence-based practices for aftercare. We set up person education, family education. We set up supported employment. We set up outreach teams. I prefer to call them outreach teams rather than ACT teams or MICM teams, because I think, again, the term case management is kind of a loaded term. I mean, am I a case that needs to be managed? Or are these cases that need to be managed? And so I prefer outreach workers, the term to that. And then the last, not least, is people with co-occurring conditions, because I'm the same person. Like I'm using to kind of calm myself down. I'm using to go to sleep at night. I'm using to kind of knock myself out so that I can actually have a pretty active or fulfilling life as best as I can without flipping out all the time and ending up in emergency rooms. So we have those 5 evidence-based practices: person education, family education, the supported employment. Most people need, some kind of support to get going. And we need the outreach teams, and then we need the working with people to get them off substance abuse, which, oncology needs that, and so do a lot of the other healthcare lines. They need those. They need the same kind of aftercare that we have in mental health. But I think that's going to be a while before they realize that that's not going to happen right away. But what we in mental health have is something we could offer other medical care lines down the road. I think the problem is that people think in mental health, people who have mental illness are less than, right? More disposable. Like I notice that, cancer patients, they're more immediate with cancer. So if you get cancer, they're on the phone, they're jumping around, they're trying to get things done. And, mental health, that's not necessarily the truth. Sometimes people have to wait for a period of time. And the other thing that I also noticed is that in mental health, we do a better job of aftercare than the other lines do. The other lines just, and we did that because people kept cycling through the hospitals. And even though people are cycling through the hospitals in the other healthcare lines, they don't seem to realize that there's another option, that they could, for about 1/10 of the price, they could keep people out of the hospitals just by having that person education, family education, doing the outreach teams, and also doing the outreach teams and doing outreach teams, doing the co-occurring conditions. Because when I went into oncology, they were given a fentanyl patch on one arm, fentanyl patch on the other, and 5 fentanyl patches to leave. And that's just going to lead to some kind of substance abuse. The amount of painkillers that are prescribed in all medical care lines is just astronomical, So, how to get people off that stuff, when they don't need it, and get them into another healthier lifestyle. That's why the RAP plan's great, right? Wellness, action, recovery, plan. So we need those kind of things in the other medical care. But I think that mental health is just seen as, I don't know, those of us who have mental illness are seen as kind of non-people, and even our mental health line is seen as fluff or not important. And so it's going to take a while to the other medical lines to realize that they need the knowledge that mental health has accumulated over the past 50 years. This system, when I first came into it, I was more haunted by the screams and the yells of people being given involuntary electroshock in the back rooms of the hospital where I was at, in the Oakland Ava Hospital. I was more haunted by the people being given involuntary electroshock than I was of anything that happened to me in the Vietnam War. And I was in 20 combat missions in Vietnam, right? So I was in a lot of combat in Vietnam. I was more haunted by the screams of people in the morning. They just would juice people in the back room with electroshock and then drag them out to the group room with pee all over the front of them and pooping their pants and everything because they'd been jolted so much from the electroshock. They were stunted, couldn't talk. So, that was mental health back in 1966. So we've come a long way since mental health 66 till today. And peers, I think, peers returning to work in the mental health system is important because, we know the system, we understand the condition, although this condition is very variable. I mean, even today, I'm still learning how to get enough sleep or not get myself too flipped out, or I'm learning how to navigate through life even though I don't feel good, how to get myself going even though I might be depressed. So mental health understanding the mental health condition is still elusive. I mean, it's a lifetime of learning, just like I'm going to have to learn to live with my new after effects of cancer care. Same principles, right? And so I think that it's all possible, but it's going to take a long time. But what else do we have? We just have time. And eventually that will be part of the system. And that's what happened to me. So anyway, peers just became part of the system. Didn't need research. Peers more or less became best practice. You can't, in the state mental health system, even in VA now, you can't get accredited. You can't get accredited by CARF, C-A-R, certified for a rehab facility, something like that. You can't get accredited unless you have peers working in the system. So in the end, that's how it played out. You have to have peers, whether you're in the state system or whether you're in the local system. To get accredited now, you have to have peers working in the system.